Okay. So, good day everyone. My name is ATHIRAH HAYANI, BINTI Muhammad SHAPIE, metric number A95379. So, from my perspective, from a patient point of view, which affect the patient's quality of care, imagine arriving at a hospital feeling sick in the hopes of receiving help right away, only to be informed that you have to wait for hours because there are not enough nurses or doctors. This is the current reality that many Malaysians must deal with. The shortage of healthcare workers means patients must wait longer to see a doctor, and when they finally do, the rush care can lead to the mistake or misdiagnosis, which can affect the quality of care of the patient. So this could be dangerous or even fatal for someone in need of immediate help. Patients frequently have to wait longer for their treatment and hurried consultation because of lack of healthcare workers, for example, like doctor, nurses, or other allied health professional. Because of heavy patient load, healthcare professional cannot give each patient the time and attention that they need. So, a 2023 report found that Malaysia had almost 6,900 vacant positions for healthcare workers, and the ratio is actually very low, patient to staff ratio. So research has indicated that insufficient staff raises the possibility of medical mistake. Patient will receive a lower quality of care if the system is unable to handle this issue. So this is not a temporary problem, it is actually the long-term consequence. The healthcare system will become overburdened if the shortfall keeps happening. And research indicates that patient fatality rate increase and recovery period prolong in nation. For example, for the elderly patient and those with chronic condition will be the one most impact if immediate action is not taken. So what are the solutions? The first one is attractive working conditions. For example, like improve the salary, job benefits, and career development to attract a new talents. And the second one is encourage partnerships with international institutions for a better training program. And the last one is utilize the technology and innovation, for example, like implement telemedicine, use AI-assisted tools to support the overburdened healthcare workers. So, who should act? The first one, the government, the Ministry of Health should increase the healthcare funding. And hospital and clinic also must improve the working conditions and invest in staff development. So it can improve the patient care. So more healthcare workers will mean shorter wait times and more personalized care for the patient. So it's time for us to act. By working together, we can guarantee that every Malaysian receive the best medical care that they belong to. So that's all from me. Thank you.
Hi, my name is JUIN, matrix number A192005 from set 22. Do you know that Malaysia population is aging rapidly, with the number of people aged 65 and older growing from 72% to 74% in just 1 year? By 2040, the elderly will number over 6 million, nearly equal to the younger population. And this demographic shift will strain our healthcare system. Here's the question: are we prepared to meet the rising demand for healthcare services? The healthcare system in Malaysia is under immense pressure due to aging population, as long-term care and the management of chronic disease are becoming more and more important. However, the healthcare workers to patient ratio are below international standard, indicating an extreme shortage of healthcare workers in the nation. The majority of patients in Malaysia are served by overcrowded and understaffed public healthcare facilities, especially in rural areas. The shortage of geriatric specialists and qualified carriers make fulfill the needs for older population more difficult. Imagine an elderly woman waiting hours in an overcrowded hospital for a doctor who's juggling far too much patient. These are no isolated stories. They are reality for many Malaysians today. As Malaysian population age, the healthcare system is juggling to keep up. The shortage of healthcare workers means longer waits for treatments, limited access to specialist care, and overworked medical staff who risk burnout. Families are left to shoulder the burden, often without adequate support or guidance. If we do nothing, the strain on patients, families, and healthcare workers will only worsen. Overcrowded hospitals, untreated conditions, and declining quality of care will become the norms. Do you want your beloved elderly to face such crises? To address the challenge posed by aging population, the government must take proactive steps to strengthen the healthcare system. First, we need to expand training programs for healthcare professions, particularly in geriatrics and elder care, to meet the specific needs for older adults by increasing the intakes of students in this specialist field and providing incentive for healthcare workers to serve in aged care. We can ensure the workforce is equipped to manage an aging society. Second, improving healthcare access in rural areas is crucial. The government should offer better incentive for healthcare workers to take up posting in this underserved region, where the elderly population often face significant barriers to care. Finally, integrating technology such as telemedicine will make healthcare more accessible for older Malaysians, especially in remote areas, reducing the pressures on physical healthcare infrastructures. Everyone, it's time for us to rise and shine. The government must act and prioritize and the development of healthcare workers ready to meet the needs of aging populations, but also ensuring equitable access to care in all regions. I urge policymakers, healthcare professions, and the public to engage in this crucial conversation. Let's push for better training programs, increased support for healthcare workers, and the integrations of technology to ensure that Malaysia's healthcare system can provide for elderly. Together, we can build a sustainable, inclusive future for all Malaysians. That's all from me. Thank you.
Hi everyone, my name is Mohamad HILMAN SALLEH. Number matric is 193641, set 22. Imagine being a bright student determining becoming a doctor only to realize the cost of medical education is simply too high. These are the harsh reality many young Malaysians face, leading to a growing healthcare crisis. Between 2017 and 2021, the number of medical graduates dropped by 31%. The decline threatens not only the future of healthcare in Malaysia, but also the well-being of its citizens. The core of the problems lies in three areas, which are rising education costs, fewer scholarships, and a bottleneck in training. Private medical schools charge fees underwards of 30,000 ringgit, making it out of reach for many. Public universities are no better, with high living costs and limited opportunities for part-time work. Meanwhile, scholarships for medical students are decreasing based on the mistaken belief that there's an oversupply of doctors. However, rural areas still face doctor shortage. For example, in Sarawak, one doctor is responsible for 62 patients for exceeding the WHO's recommended ratio. To make matters worse, even students who graduate face delays due to insufficient internship position. In 2009, the houseman period was extended from 12 to 24 months, but without increasing the number of available positions, causing frustration and stagnation in career progression. The impact of widespread fewer medical graduates means fewer doctors to care for an aging population and rising chronic diseases like diabetes and hypertension. Without enough healthcare professionals, rural and underserved areas suffer, leading to longer wait times or no access to care at all. We need to act now. A comprehensive solution involves two key actions, which are reinstating and expanding financial aid and increasing training capacity. Scholarship must be increased, especially for low-income and rural students. Government-backed student loans with flexible repayment options can ease financial burdens. Graduates should be encouraged to serve in underserved areas through agreements that link financial aids to rural service. The government should partner with private hospitals and regional healthcare centers to expand international position. We need more medical school infrastructure to accommodate rising enrollment numbers while maintaining high quality. Who should act? First is government. Government need to increase funding for scholarship and infrastructure development. Second is private sector and NGOs need to provide financial aid, training position, and support the rural healthcare. Education institution needs to expand medical school facilities and adapt curriculums to meet current needs. And healthcare association needs to advocate for reform and support retention efforts. This approach removes financial barrier by expanding scholarship and financial aids, increases the healthcare workforce by addressing training bottlenecks, and improve rural healthcare by offering incentive for doctors to serve in underserved areas. It also ensures long-term sustainability by securing funding and creating a steady pipeline of healthcare professionals. Here's the impacts. First, for student more access to medical education regardless of financial background. For communities, better healthcare access, especially in rural areas. For the healthcare system, a stronger, more resilient workforce. For the nation, better public health outcomes and economic growth. The future of Malaysia's healthcare system depends on our action today. We must support initiatives that make medical education more accessible, expand training opportunities, and strengthen our healthcare workforce. Together, we can ensure a healthier Malaysia for generations to come. Thank you.
Assalamualaikum and hi, my name is Muhammad IMRAN Baheze. My number matric is A195669. Imagine a loved one needing urgent care only to wait hours because there aren't enough doctors and nurses available. This isn't a distant possibility. It's happening now. Healthcare workers are leaving the profession at an alarming rate due to burnout and exhaustion. If we don't act, our healthcare system risks collapse. Burnout among healthcare workers has reached critical levels. Long shifts, emotional exhaustion, and chronic understaffing are taking their toll. Studies show that up to 30% of nurses leave their jobs annually in some regions. This creates a vicious cycle. Fewer staff means heavier workloads for those who remain, leading more mistakes, reduced patient care quality, and even worse burnout. Healthcare workers are suffering from anxiety, depression, and chronic health issues. Patients are waiting longer, receiving less personalized care, and experiencing increased risk. Meanwhile, hospitals are shouldering the financial burden of high turnover. With some losing millions annually to hire and train replacements, we are at breaking point. Healthcare isn't just about technology or buildings, it's about people. Healthy, supported workers provide better care, make fewer errors, and stay in their roles longer. Addressing burnout isn't just the right things to do, it's essential for safeguarding public health and the future of our healthcare systems. We owe it to those who care for us to take action. My solution is comprehensive. Three-pronged approach. The first one is improving workplace conditions. We must increase staffing ratios and integrate flexible scheduling to reduce workload and give healthcare workers the time they need to recover and thrive. Second one is mental health and career support. Providing accessible counseling services, peer support programs, and financial incentives like retention bonuses will address emotional and financial stressors. And the last one is leveraging technology. AI-driven workload distribution and virtual mental health platforms can streamline operations, reduce inefficiencies, and offer on-demand support. These strategies are practical, scalable, and customizable. Pilot programs implementing similar measures have already shown improved job satisfaction, better retention rates, and significant cost savings. If we don't act now, healthcare system will face devastating consequences. Patients will experience longer wait of times, worse outcomes, and reduced trust in care. Workers will continue to leave, leading to a cycle of understaffing and inefficiency. Long-term damage could take years or even decades to repair. What makes this approach different is its combination of evidence-based interventions with cutting-edge technology. It's not just a short-term fix, it's a sustainable framework for creating supportive and resilient workplace where healthcare professionals want to stay. Now it's time to act. Support healthcare workers by advocating for policies that improve their work environment. Join local initiatives, push for funding, or even start conversation within your own organization. Our healthcare workers have been there for us through the toughest times. Now they need us. By addressing burnout and turnover today, we are building a stronger, safer healthcare system for tomorrow. Let's ensure the people who save lives every day feel valued, supported, and empowered to continue their vital work. Thank you.